Hi, good morning, everybody. Welcome to the Conscious Living Show. I'm Patricia Hamilton, and Conscious Living is all about bringing new information, bringing insights and understanding into all the fields that are now emerging of expanding consciousness in health and environment and spirituality. And this morning I've got the pleasure of talking with Paul Maver. And Paul is the director of Health House International, and he's involved with a very exciting field of research and development, and that is medical cannabis. So, welcome, Paul.
Good morning.
And look, I'm fascinated because you told me that you were a complete skeptic when it came to cannabis. And being a pharmacist, I can imagine that you were pretty much trained in the traditional scientific, evidence-based field of medicine. And you were very skeptical about natural therapies as well. So what turned you around?
Well, we always saw cannabis as a dangerous, highly addictive drug, and we never saw it as a medical option. But a few years back, I saw some horrific data relating to pharmaceutical opioids and the massive death toll they have. They're highly addictive, and they cause a lot of harms, very easy to overdose on, and in a lot of patients they cause constipation. So I first became interested in cannabis because I saw some statistics that showed cannabis was responsible for 0 deaths and very difficult to overdose on. So as a treatment for chronic pain or end-of-life pain, it certainly may be an option for some patients.
And what is really fascinating is you were just telling me earlier that, in fact, in your research you discovered that in the 1930s, pharmacists were prescribing cannabis in various forms to treat pain and other ailments. Is
That's
that correct?
Well, circa 1930s, doctors were prescribing and pharmacists were dispensing medicinal cannabis for some of the same things, some of the same conditions we're starting to rediscover now, like chronic pain or end-of-life pain or drug-resistant epilepsy. So we've come a full circle.
I think that's fascinating. And also, what you were telling me is that Australia is now really at the forefront of researching into medicinal cannabis.
There's some really exciting projects happening, and at last count I think there's 35 different research projects involving medicinal cannabis in Australia, from all levels, from preclinical through to RCTs with placebos.
And so has happened very recently, hasn't it? Because you were the first company to import medicinal cannabis
That's
into
correct.
Australia. And when did that happen?
That was May 2017, and since then there's been a lot of different products come into Australia, and we're now producing GMP grade medicinal cannabis here in Australia. Based in there's a West Australian product that's to market, and more and more patients have been able to access. But some of the research behind it is quite exciting as well, because it will potentially open up a number of different conditions and give prescribers some evidence to actually roll it out to more patients who could benefit.
So let's talk about the conditions that people who might be listening may have and may want to know if they would be eligible to access medicinal cannabis.
Yep, certainly. So there's 4 main conditions where there's good clinical evidence, and of those 4, 80% of the patients roughly we've seen accessed in Australia have been accessing for chronic pain. And whilst there's other drugs for chronic pain, medicinal cannabis is found to help some of those patients not only be pain-free but sleep better. It's got a mild anti-anxiety in it, and it's giving some of them an appetite. So it's really for
So
the right patients.
what kinds of chronic pain conditions would be suitable?
Particularly neuropathic pain, where there's nerve pain. We've seen patients with really bad back pain, what they call diabetic neuropathy, different pain conditions. Anything where there's long-term
Arthritic pain?
Yeah.
Because, I mean, we're all aging, as we talked before. We're living longer, and our bodies are, developing aches and pains. So, I mean, how serious of level of pain do you need to have before you can actually apply to use this medicinal
To,
cannabis?
to access medicinal cannabis in Australia, you need to have exhausted a number of other options.
Okay.
It's not a first-line treatment. There are a lot of other drugs for pain, so you should perhaps try them. Things like paracetamol or some anti-inflammatories, or alternative things like massage or exercise. Cannabis sits on the scale that it's not, as I say, first-line treatment, but where people are living in pain, and it won't get rid of the pain entirely. It may reduce the pain score to make it easier to go about your day-to-day life.
So how do people go about starting that process? Do they need to go and see their medical doctor
Certainly.
first?
Certainly.
Okay.
So to access it legally in Australia, you need to first see a GP because they know your medical history. You may then need a referral to a specialist, particularly a pain specialist, or there are a few clinics who can handle pain patients in Australia and make it easy for them to access medical cannabis.
And so you were telling me earlier that there's a big uptake now in the last 2 years. How many people roughly would be receiving medicinal cannabis?
That's right. We're seeing quite a significant month-on-month growth for approvals for medical cannabis. And in the first year, to give you some idea, there was only 300 patient approvals.
Wow.
At the end of year 2, there was 2,000. And we're heading towards year 3, where we're looking at up to 20,000 patient approvals. So we're seeing some significant growth. In Canada, they were up to 300 to 400,000 medical patients, and we expect to be on a similar trajectory and aiming for about 5 years. We're looking at about 100,000 patients here in Australia to legally access it.
That's fantastic. And the other really interesting and exciting area that we were discussing was cancer research. And here in Perth, you were telling me about a project at Curtin University. Can you share a little bit about that? Because I know that, cancer and cancer treatments using traditional forms of chemotherapy are really nauseating and invasive. And you were saying that there is a potential for medicinal cannabis to alleviate that, or perhaps work in harmony with those treatments, and that sounds really interesting.
Okay, so where we're at the moment, one of the 4 major conditions for cannabis where there's good clinical evidence is cannabis for nausea in cancer-related chemo, and that's across the line. It's giving some patients an appetite where they are nauseous, and whilst there are other drugs for nausea, I'm told nothing helps that metallic-like tongue feeling that patients get on chemotherapy quite like cannabis, and gives them an appetite and quality of life. But here in Perth, we're having quite a bit of research done on pancreatic cancer, and Professor Marco Falasca of Curtin University has done some interesting work, preclinical work involving rat models, where he's combined chemotherapy and cannabis and found that's extended the lives of his rat subjects quite considerably. So he's looking at following that up with a human trial, which is badly needed because it's quite a bad cancer they have, and treatments haven't evolved in the last 50 years. So this offers hope to some of those patients.
Yeah, it's very exciting. And you were saying that the whole field of endocannabinoid research and understanding is also fairly new to a lot of doctors and people in the medical profession.
That's right. So the endocannabinoid system, the actual receptors that the cancer chemicals work on, was only discovered mid-90s, and most medical professionals, myself included, were not formally trained on that at university, and it's only just been started to be taught in medical schools now. And it's responsible for things like the immune function, appetite and pain, and more and more has been discovered about this and studied about it, and hopefully in the future we'll know a lot more about that system.
So isn't it interesting that a drug that was formerly prohibited and illegal is now being responsible for actually opening up a whole new field of scientific research?
That's right. It's virtually a pharmaceutical treasure trove. There's 144 different cannabinoids in the plant, as well as a bunch of terpenes and other ingredients that we're still researching exactly what does what, and we've got quite a few years ahead of us before we can unlock things to the extent we need to.
So the humble plant is really giving rise to amazing solutions for us at this time on our planet and in our population. And you're going to be sharing more about this, how people can get access, what kinds of conditions and how effective the treatments are at Conscious Living Expo coming up in October.
That's right.
So do you want to just give us a little bit of an entree into who would be interested to come along and learn more? What sort of conditions or people
Certainly
would benefit from coming to the talk?
Well, anyone who's interested in cannabis as a treatment option, we've had a lot of patients, medical professionals, even business people interested in this space. Some people have been looking at cannabis medicinally for a number of years. But typically we like to separate fact from fiction. There's a lot of misinformation in that space and exactly what cannabis is capable of, what some of the research is happening. There's some really exciting areas of research in Australia, as I mentioned, and where we're heading from a business level, because I think it's really important to tie in an economic argument with the medical side of it.
Yeah, exactly, and you're doing some really interesting stuff in that space as well. So one of the questions I had, just the last question, I know there's a movement to legalise marijuana, and a lot of people probably would be thinking, well, what if I'm smoking marijuana? Is that going to have the same effect as the medicinal cannabis in treating pain or nausea?
Yep. Great question. I don't think smoking is a very good delivery method for cannabis. You're getting the wrong levels. You're getting more of the psychoactive components. It's better.
So it's not as pure. Or
it's the same cannabis, but when you take it orally, you're getting microdoses. When you smoke it, you're getting massive amounts over a shorter period.
Right.
And if you can imagine when you take, say, an antibiotic or a blood pressure tablet, you're getting low levels orally over a 24-hour period. And most of the conditions that we found cannabis to be a benefit for are chronic illnesses that people have got over a period of time. So they need good levels of a drug over a period of time rather than massive amounts short term.
Yeah.
And orally is a better delivery method in a lot of cases for most medicines, and the same is the case with cannabis, and patients are getting good medical levels without the psychotropic effects or getting high.
Yeah, yeah. And the other question I had was there's a lot of interest in CBD oil. And I know that at the moment it's not legal in Australia to distribute and sell that product, which is also it's also extracted from cannabis, isn't it?
Yeah, sure. No, CBD is legal on prescription.
On prescription.
So you can access it, and it's actually a lower schedule for pure CBD than if the product had THC in there. So you can. It is easy to access it. And hopefully over time access will improve.
Fantastic. So people are going to find out a lot more. I'm sure there'll be a lot more questions at the talk, Paul. So how can people get in touch with you if they want to, learn more? If they want to get, I know that you've got an association with Medical Cannabis Research Australia. So what would be the website and?
I run a company called Health House, healthhouse.com.au. I'm director of that. Or you'll find me on social media on LinkedIn or Facebook.
Fantastic. Look, we could talk for hours about this. I think it's just a most amazing subject, and I think you're an amazing pioneer that you're doing all this work, and that you're living in Perth, but you're travelling around the world and addressing conferences, and you're involved with education and sharing your knowledge. So I really appreciate you coming to the Conscious Living Expo, and I look forward to seeing you there.
Thank you. I look forward to seeing everyone there and answering everyone's questions.
Thanks, Paul.